Subscribe my channel to upload more videos.
Question 1. A 6-month-old infant is brought to the emergency department in severe respiratory distress.
A diagnosis of respiratory syncytial virus is made and the infant is admitted to the pediatric unit. What instruction should be included in the nursing plan of care? A place in a warm, dry environment. B. Allow parents and siblings to visit. C. Maintain standard and contact precautions. D. Administer prescribed antibiotic immediately. The correct answer is C. Maintain standard and contact precautions. Question 2. An infant is admitted to the neonatal intensive care unit with exstrophy of the bladder. What covering should the nurse use to protect the exposed area? A loose diaper. B. Moist dressing. C. Dry gauze dressing. D. Petroleum jelly gauze pad. The correct answer is B. Moist dressing. Question 3. The nurse is aware that an additional defect associated with exstrophy of the bladder is A. Imperforate anus. B. Absence of one kidney. C. Congenital heart disease. D. Pubic bone malformation. The correct answer is D. Pubic bone malformation. Question 4. When caring for an infant born with exstrophy of bladder, the nurse understands that the infant is at the greater risk for A. Infection. B. Dehydration. C. Urinary retention. D. Intestinal obstruction. The correct answer is A. Infection. Question 5. A child born with exstrophy of the bladder is admitted to the pediatric unit for urinary diversion surgery, wherein the ureters are transplanted to a resected section of the colon with one end attached to the abdominal walls. In ileostomy, the nurse explains the procedure to the parents and states that it is called A. Cystostomy. B. An ileal conduit. C. An ureterosigmoidostomy. D. A. Cutaneous ureterostomy. The correct answer is B. An ileal conduit. Question 6. The nurse explains to a parent group that immunizations are important because A. Complications of mumps in postpartum males is a sterility. B. Hypopituitarism. C. Decrease in libido. D. Decrease in androgens. The correct answer is a sterility. Question 7. When performing a physical assessment of a newborn with Down syndrome, the nurse suspects that the infant may have a bulging fontanelles. B. Stiff lower extremities. C. Abnormal heart sounds. D. Unusual pupillary reactions. The correct answer is C. Abnormal heart sounds. Question 8. The nurse is teaching a group of parents about the side effects of the immunization. Vaccines. Which side effect is expected when an infant receives the Haemophilus influenza vaccine? A lethargy. B. Urticaria. C. Low-grade fever. D. Generalized rash. The correct answer is C. Low-grade fever. Question 9. When explaining the occurrence of febrile seizures to a parent's class, what information should the nurse include? A. They may occur in minor illness. B. The cause is usually readily identified. C. They usually do not occur during the toddler years. D. The frequency of occurrence is greater in females than males. The correct answer is A. They may occur in minor illness. Question 10. A mother tells the nurse in the emergency department that her 3-year-old has had a fever for several days and has been vomiting while instituting nursing measures to reduce the child's fever. The nurse should also prevent shivering. B. Restrict oral fluids. C. Measure output hourly. D. Take vital signs hourly. The correct answer is A. Prevent shivering.